Welcome to the first episode of 52 Questions on the Street. I'm Shannon Weber, Director of Hive. Every year, Hive receives hundreds of questions from patients, their partners, and providers. And in 2018, we're bringing you one of those frequently asked questions each week in video format. I'm here today with Jonathan Fuchs, the most amazing Jonathan Fuchs. And it's not letting me flip it, Jonathan, so we're doing it like this. Okay, and the question for this week that Jonathan is going to answer is, does PrEP use increase the rates of STIs? Jonathan.
You know, that's a really good question, Shannon. I think we get this question often. And when you think about it at the population level, the way I like to try to think about it is we have a large study that was done, the PrEP demonstration project, funded by NIH. We have over 500 men who had sex with men who participated in that. STI rates were high overall, but they remained high, and there was no increase in STDs that were detected over time. So that's important, and also no increase in risk behaviors, so things like condomless anal sex over time, or number of partners over time. So that's important. The other major study that I like to refer to is this modeling study by Janess and colleagues, and what they said is that if there was 40% coverage of PrEP at the population level in the community at risk, and even if that population were to increase their risk behavior, having increased condomless anal sex by 40%, but screening for STDs happened every 6 months, and treating STDs that were detected, you'd still find a 40% decline in STD rates overall in that population over 10 years. And if you were to decrease the screening interval to every 3 months, you'd actually decline by 50%. So in fact, PrEP, which is not just a pill, it's regular HIV testing and STI screening and treatment, can actually be a strategy to prevent STDs in the future. So it's a full package of not only trying to prevent HIV, but also maybe a way to try to prevent STDs in the future.
Awesome, thank you for that answer. Join me next week where I'll answer the question, how does PEP or post-exposure prophylaxis work?